Valkyrie. Give the rookie Mercer. Dr. Melissa Crane said it during morning rounds as if she were assigning a difficult chart instead of a human being. 6 residents stood around the nurses' station at Potomac Veterans Neurological Center, and a young intern named Owen Price held his phone close to his chest with the camera already open. Across the hall, Chief Petty Officer Grant Mercer sat alone in room 418. He was 39, a former Navy SEAL, paralyzed for 8 months, rejected by 4 rehabilitation physicians, and described in his chart as hostile, resistant, and emotionally unstable. Crane tapped his file. He refuses examination, positioning, and implant preparation. Since Dr. Hart is eager to prove herself, perhaps she can succeed where everyone else failed. A few residents smiled. Dr. Evelyn Hart stood at the end of the desk wearing a white coat that still looked new. She had worked at Potomac for 12 days. Why does he refuse positioning? Because he likes control. That is not a medical answer. Dr. Simon Bale stepped out of his office. He was 58, silver-haired, precise, and respected enough that younger physicians lowered their voices when he entered a room. Chief Mercer suffered a complete C5 spinal cord injury. His behavior is part of the adjustment process. Can he communicate reliably? Evelyn asked. When he chooses to, Crane said. Bale checked his watch. Tomorrow, Mercer will participate in the neural stimulation demonstration for the board and military research committee. Today, he needs final respiratory testing. Crane pushed the chart toward Evelyn. Your first impossible patient. Room 418 stood at the end of the rehabilitation corridor. Grant sat in a motorized wheelchair facing the window, his back toward the entrance. A padded support held his neck slightly forward, his chin too close to his chest, and every breath came shallow and uneven. His oxygen was 93, and his pulse 106. A nurse named Hannah Cole stood near the bed. He would not let us adjust the chair, she whispered. Grant's eyes moved toward the reflection in the window. Evelyn stopped 3 steps inside the room and checked the oxygen line, emergency switch, exits, monitor cables, and space around the chair. Grant watched every movement through the glass. Crane entered behind her with Bale and the residents. Owen remained near the doorway, phone angled toward the room. Chief Mercer, this is Dr. Hart, Crane said loudly. She is new. Grant closed his eyes in one long blink. Evelyn stepped around the chair until he could see her without turning his head. His face was lean beneath a short dark beard, and a scar crossed his left temple. His eyes were not defeated. They were furious. My name is Evelyn Hart. I will not touch you without permission. Blink once for yes and twice for no. Can you understand me? 1 blink. Is the chair position making it harder to breathe? 1 blink. Does it improve when your neck is supported? 1 blink. Bale said, he has chronic respiratory weakness from cervical trauma. Evelyn watched his oxygen fall to 92. May I adjust the head support? Grant blinked once. She placed one hand behind his neck and the other against the support. The instant her fingers touched the base of his skull, his expression changed. Not fear, recognition. She lifted his head less than an inch and returned his neck to neutral. His next breath entered deeper. Oxygen rose to 94, and his pulse fell below 100. Hannah noticed first. That quickly? Evelyn secured the support. Is this better? 1 blink. Bale studied the monitor. Positional variation is common. Then why was he left in the position that makes it worse? No one answered. Grant's right thumb pulled inward once against the padded armrest. Evelyn saw it. Bale did not. Grant's eyes dropped to the thin white scar disappearing beneath Evelyn's sleeve. His lips moved without sound. She leaned closer. What did you say? Air scraped through damaged vocal cords. Val. Crane stepped forward. He tires easily. Grant tried again. Valkyrie. Evelyn stopped breathing. No one had spoken that name to her in 6 years. Valkyrie had been painted on a flight helmet and spoken through encrypted radios when wounded men waited for an aircraft to carry them home. Grant watched her face. He knew. Before we continue, welcome to Emergency Legends Archive. If you enjoy stories about quiet heroes and impossible diagnoses, subscribe, leave a like, and tell us where you are listening from. Crane laughed softly. Medication confusion. Bale looked at Grant. There is no Valkyrie here. Grant's eyes moved in a pattern. Upper left, center, lower right, identity check. Evelyn answered with 2 light taps on the wheelchair rail, a pause, and 1 more. Friendly recovery. Grant's eyes filled. Bale noticed her hand. What are you doing? Establishing communication. That was not a medical communication system. It worked. Grant forced out another word. Mako. Mako had been Grant Mercer's field call sign during Operation Cold Passage. Evelyn had spent 19 hours trapped with him beneath a collapsed underwater access tunnel, keeping 3 injured men alive in darkness. He had lost consciousness before the final extraction. She had never known whether he remembered her. Crane's expression sharpened. You know this patient. I treated him before. Where? I cannot discuss it here. Bale's voice cooled. You failed to disclose a prior relationship with a research patient? I did not know Grant Mercer was your patient. Grant's pulse climbed and his thumb moved inward again. Stop. Evelyn turned toward Bale. What procedure are you preparing him for? The spinal stimulation implant. What position? Supine with cervical stabilization. Grant's breathing changed immediately. Shorter, faster. His eyes widened. Evelyn crouched in front of him. Does lying flat make your breathing worse? 1 blink. Do you lose your voice? 1 blink. Do you feel electrical pain when your neck bends? 1 hard blink. Hannah looked toward Bale. He has complained about burning in both arms. Neuropathic pain is expected, Crane said. Bale closed the chart. His injury is complete. He has no meaningful motor function below the lesion. Grant's thumb moved again. Evelyn pointed. That was voluntary. A flexor response. Evelyn looked at Grant. Do not move your thumb. It remained still. Move it once. After a pause, the thumb pulled inward. Do not move. Stillness. Move twice. It shifted once, paused, and shifted again. Owen lowered his phone. That is command following, Evelyn said. It is inconsistent, Bale replied. He is paralyzed, exhausted, and struggling to breathe. The implant is designed to strengthen residual pathways. Only after you prove they are not being mechanically compressed. Bale's eyes hardened. You have not reviewed his imaging. Were all the scans performed in neutral alignment? Crane answered. Standard cervical protocol. His worst symptoms happen outside neutral alignment, Evelyn said. Bale shook his head. We do not provoke spinal instability to satisfy a theory. You are planning surgery without testing the position that causes the symptoms. A resident behind the chair released the head support to inspect the bracket. Grant's head tilted backward. His eyes opened wide. His mouth formed a silent gasp, and his pulse fell rapidly. Oxygen dropped to 88. His thumb stopped moving and his face lost color. Evelyn crossed the room. Return him to neutral. I barely moved him, the resident said. Now. Bale raised a hand. Slowly. Grant's pulse reached 48. Evelyn took control of the support, 1 hand beneath the skull and 1 at the jaw, and returned his neck to the exact position that had improved his breathing. The monitor continued to scream while his chest rose weakly. Evelyn looked directly at Bale. His paralysis changes when you move his neck. A severed spinal cord does not do that. Evelyn kept both hands steady against Grant's head support, while Hannah placed a non-rebreather mask over his face. His pulse hovered at 48 and his oxygen at 87. Bale called it an autonomic response. Evelyn called it what it was. A response triggered by cervical extension. Grant's pulse slowly climbed as she maintained neutral alignment. When Evelyn asked whether he could hear her, he blinked once. When she asked whether the position was better, he blinked once again. When she asked whether he wanted her to let go, he blinked twice. Crane folded her arms. He becomes dependent on anyone who validates his fears. He is telling us what keeps him breathing, Evelyn replied. Bale ordered the residents to leave so the assessment could continue. Before Owen could step out, Evelyn held out her hand. His phone was still open to the camera application, and 37 seconds of Grant's collapse had been recorded. She deleted the clip, opened the recently deleted folder, and removed it again. You were filming a paralyzed patient without consent, she said. Do not confuse vulnerability with entertainment. No one defended him. With fewer people in the room, Evelyn built a communication system Grant could use without exhausting himself. 1 blink for yes, 2 for no. Thumb inward for pain. Eyes toward the door when he wanted the room cleared. She asked whether he could feel her hand on his shoulder, arm, wrist, and thumb. He answered consistently. The sensation was stronger near the shoulder and changed when his neck moved. Hannah brought a letterboard from a drawer. Its surface was almost clean enough to prove no one used it. Evelyn moved through grouped words and Grant selected burning, then legs. The heat below his injury appeared only in certain positions, and often came before his breathing worsened. Crane dismissed it as central neuropathic pain. Evelyn did not argue. She tested it. With Grant's consent, she moved the head support forward less than half an inch. After several seconds, his thumb stopped responding and his breathing became shallow. He selected burning. When she returned him to neutral, the thumb moved again. Bale stepped closer. Repeat it. They repeated the test. The result was the same. Crane's certainty weakened. It could be positional neuropraxia. Then it is not a complete fixed deficit, Evelyn said. Bale handed her Grant's imaging record. 6 cervical scans, 3 CT studies, and 2 electrophysiology reports. All described a complete injury. Every scan had been performed with his neck supported in neutral alignment, the position in which his symptoms improved. None had been done upright, in flexion, or during controlled extension. The worst symptoms happen in the positions no one studied, Evelyn said, because unnecessary movement could worsen the injury, Bale replied. But the implant requires him to lie flat. With stabilization, Grant made a strained sound behind the oxygen mask. Evelyn pulled it slightly away. Lying flat makes you lose your voice? 1 blink. Hannah searched the nursing notes. He often stopped speaking during imaging. How was that documented? Fatigue, anxiety, or refusal to communicate. Evelyn scrolled through months of entries. Patient becomes pale when fully supine. Temporary bradycardia during transfer. Reports burning after neck flexion. Voice weakens during imaging preparation. Right thumb movement observed after repositioning. Each note had received the same physician response. Expected autonomic instability related to complete cervical injury. Your own staff documented the pattern, Evelyn said. We documented known complications, Bale answered. You labeled every new symptom as proof of the old diagnosis. His voice cooled. Be careful. With what? Asking why the diagnosis was never reopened. Crane said Grant had undergone every appropriate test. Evelyn answered that he had never undergone the test that reproduced his symptoms. She requested an independent neurosurgical review and dynamic imaging under controlled conditions. Bale refused. The implant demonstration would proceed the next day. Grant's pulse rose as soon as he heard it. Evelyn returned to the communication board. Do you still want the implant? 2 blinks. Bale said he had already signed consent. Grant selected signed before, then tried to tell. Hannah admitted that his complaints had been escalated 3 times to Bale's team. Bale said the reports were reviewed in context. Evelyn looked at him. The context was your diagnosis. Grant closed his eyes from exhaustion. His thumb moved weakly against the support. Evelyn asked whether he remembered Cold Passage. 1 blink. Whether he remembered the other trapped men. 1 blink. Then, he selected a sentence that struck harder than any accusation. Will you leave again? Evelyn lowered the board. After the investigation, she had left the service and never contacted the operators she had helped rescue. She told herself secrecy required distance. The truth was that she could not bear to learn what they believed about her. I thought staying away protected everyone, she said. Grant's eyes did not soften. That was not an answer. Evelyn admitted. No. I will not leave while you are asking me to stay. His thumb moved once for pain. This time the pressure was deep in his neck, and worse than it had been that morning. I want neurosurgery now, Evelyn said. Bale told her she could request a consultation after rounds. She replied that she was requesting it now. The argument ended when 2 technicians entered with a transport stretcher and positioning equipment. Hannah looked confused. Final implant preparation, Owen said. Respiratory measurements and supine tolerance testing. Grant's eyes widened before anyone touched him. Evelyn stepped between the stretcher and the wheelchair. This patient has withdrawn consent. Bale said he had expressed anxiety, not withdrawal. The technicians unlocked the chair supports. Grant's thumb pressed inward twice, pain and warning. His lips moved without sound as he stared at Evelyn. The word was clear. Stop. Grant formed the word without sound, but Evelyn and Hannah both saw it. The technicians did not. One reached for the wheelchair release, and Evelyn placed herself between his hand and the controls. The patient withdrew consent. Bale said Grant had expressed fear, not refusal. Evelyn asked him to question Grant himself. Bale explained the possible benefits of the implant, asked whether Grant understood them, and then asked whether he wished to proceed. Grant blinked twice. No. Crane suggested he might be confused. Grant moved his thumb once, then twice, signaling pain. The right side of his head support had shifted less than half an inch when the technicians unlocked it. Evelyn corrected the angle, and his breathing eased. I want an independent neurosurgical consultation and dynamic imaging, she said. Crane argued that moving the neck of a patient with cervical trauma was dangerous. Evelyn replied that placing an implant near a cord with unexplained positional symptoms was more dangerous. Bale ordered the preparation canceled for the moment, and told Hannah to document physician obstruction. Document the patient's refusal, too, Evelyn said. Grant's pulse slowly fell below 100. His eyes remained fixed on her. She had stopped one thing, but he needed her to stop the next. 3 hours later, the hospital auditorium filled with board members, research coordinators, military medical officers, donors, and residents wearing their cleanest coats. A screen displayed Bale's presentation, Restoring Function After Complete Cervical Injury. Grant's name appeared beneath it. Evelyn stood at the back beside Hannah. They are presenting without him? Hannah's face tightened. They moved the live demonstration to this afternoon. The side doors opened. Grant entered on a transport stretcher, fully flat, his head secured inside a molded support. His face was pale, and a respiratory technician assisted his shallow breaths with a manual ventilation bag. Evelyn crossed the aisle before she had time to think. Bale stepped down from the stage. You are not part of this demonstration. He withdrew consent. He signed a revised form 40 minutes ago. How? Thumbprint with witnessed confirmation. Grant's eyes found Evelyn, wide and frantic. She leaned over him. Did you consent? 2 blinks. Bale said he had been informed clearly. Evelyn asked who had interpreted his response. Crane admitted she had. You were the physician who called his communication unreliable. He indicated agreement before becoming anxious. Grant tried to move his thumb. Nothing happened. His chin had been raised slightly to fit the airway support. The extension was small, but his body did not treat it as small. His pulse fell, and his oxygen reached 87. Evelyn placed both hands beside his head without moving him yet. Can you feel your right hand? 2 blinks. Your left? 2. Can you breathe deeply? 2. A board member stood. Dr. Bale, is this expected? Transient autonomic instability, Bale said. Evelyn turned toward the audience. It is positional neurological decline. Bale's face hardened. You are addressing the board without authorization. I am addressing the people watching a patient deteriorate. Grant's heart rate fell below 60. The respiratory technician increased oxygen. Evelyn ordered his neck returned to neutral. Bale warned that movement without imaging could worsen instability. He is already worsening. Dr. Priya Nair entered through the side door, wearing surgical scrubs beneath an open coat. She had been told this was a stimulation demonstration. Evelyn gave her the facts in 1 sentence. Bradycardia, respiratory decline, loss of voluntary thumb movement with extension, and improvement in neutral alignment. Priya checked Grant's pulse. How much correction helped before? Less than 1 inch. Slowly. Maintain inline support. Evelyn moved the headrest only a few degrees. Grant's pulse stabilized, then climbed. His oxygen returned above 90. When she asked him to move the right thumb, nothing happened at first. Then it pulled inward. The auditorium went silent. Priya's eyes sharpened. That is not a fixed, complete deficit. Bale called it residual reflex activity. Priya reminded him that Grant had followed a delayed command only after positional correction. The military medical officer in the front row stood and ordered the demonstration stopped. Grant returned to room 418 under continuous monitoring. The auditorium emptied without applause, leaving Bale with questions he had expected to control. In the imaging review room, Priya examined 6 MRI studies. There was cord thinning at C5, post-traumatic change, and scar tissue. Then she enlarged an asymmetric pale structure behind the spinal cord. It appeared small in one image and nearly absent in another. Could be arachnoid scarring, she said. Enough to cause this? Evelyn asked. Not in neutral. Bale folded his arms. Which is why it is incidental. What if the space changes with position? Evelyn asked. Priya considered the possibility of a dynamic arachnoid cavity, an adhesion, or intermittent obstruction of cerebrospinal fluid. She proposed controlled CT myelography with minimal flexion, full monitoring, and immediate reversal at the first neurological change. Bale called the risk unjustified. Priya answered that implanting a stimulator beside an unexplained compressive process was unjustified. She formally canceled the implant until the diagnosis was resolved. The study began that evening. Grant remained awake with Evelyn standing where he could see her. Priya controlled every movement. In neutral alignment, contrast moved around the cord, and the images looked almost unchanged. Bale stood behind the glass and said they had found nothing. Priya ordered 3 degrees of flexion. Grant's eyes signaled burning. The next image showed the pale structure behind the cord expanding into a thin, fluid-filled wall and pressing forward. They returned him to neutral, allowed the symptoms to settle, and then asked whether he consented to one more minimal adjustment. Grant blinked once. At 5 degrees, his pulse rose, and his right thumb stopped responding. The image loaded. A large post-traumatic arachnoid cavity stretched from C4 to C6, while dense scar tissue tethered the cord against the front of the spinal canal. Priya immediately returned him to neutral. His breathing improved, and his thumb returned after several seconds. Bale entered the control room and called it a contrast artifact. Priya placed the neutral and flexed images side by side. In one, the spinal cord still had space. In the other, it bent under pressure inside the scar tissue. Then she enlarged a thin line of preserved tissue running through the compressed segment. Those are continuous pathways, she said. 8 months of symptoms had been dismissed as anxiety, refusal, and adjustment to disability. Grant had been trapped inside a diagnosis everyone trusted more than him. Priya traced the expanding cavity on the screen. His spinal cord was never completely severed. Something has been strangling it. Priya kept the neutral and flexed images side by side. In the first, Grant's spinal cord rested inside a narrow but open channel. In the second, the arachnoid cavity expanded behind it, and scar tissue pulled the cord forward until the space almost disappeared. Bale insisted the original diagnosis was not wrong. Priya answered that it was incomplete. The cord remained badly damaged. Grant still had profound motor loss, and 8 months of paralysis could not be erased. But preserved pathways ran through the compressed segment, and the positional change proved that some of his neurological loss was dynamic rather than fixed. What can be done? Evelyn asked. Priya described a possible decompression. Open the dura, drain the arachnoid cavity, release the adhesions, and restore fluid flow around the cord. She also described every risk. The scar tissue was attached to fragile neural tissue. Surgery could destroy the thumb movement, weaken his breathing permanently, leave him ventilator-dependent, or kill him. Doing nothing carried its own danger. The cavity could continue expanding until the remaining pathways disappeared. Bale said it might remain stable. Priya looked at him. His symptoms are worsening, according to tests performed tonight. According to 8 months of nursing documentation, Grant returned to room 418 with strict neutral precautions and continuous respiratory monitoring. When Priya explained the findings, he asked how long the compression had been present. She told him it likely began after the original injury and worsened as scar tissue formed. 8 months, he whispered. No one answered. He looked directly at Bale. Told you. Bale replied that Grant had reported symptoms consistent with his known injury. Grant forced out 2 more words. Told everyone. Hannah arrived with the earlier nursing notes. There were dozens, written by 6 different nurses. Electric sensations in both hands during transfers, voice weakening when the head support changed, right thumb movement after repositioning, heart rate dropping during extension, breathing difficulty when flat, and refusal of supine therapy. Each note had received a short answer from the medical team. Expected complication, no new intervention, behavioral resistance, or anxiety related to disability adjustment. How many times was neurosurgery consulted after admission? Evelyn asked. Once, Hannah said. Before the positional symptoms became clear. Grant used the board to select the phrase, not addressed. Bale called the conversation an accusation based on hindsight. Evelyn told him hindsight would mean the evidence appeared after the outcome. His staff had documented it while it was happening. He reminded her that she was new to neurological rehabilitation. Evelyn answered, I am new to this building. Priya supported a full surgical evaluation. Bale argued that tissue continuity did not guarantee meaningful recovery. Grant moved his right thumb once, then twice on command. That is meaningful to him, Evelyn said. Bale still wanted the implant considered after decompression. Evelyn stared at him. You built a treatment around the diagnosis instead of rebuilding the diagnosis around the patient. The sentence landed because it was true. Bale had spent months seeing every new symptom through the study he wanted to complete. The version of Grant in the research file had become more important than the man in the chair. Priya said she would document the surgical risks. Bale should document why a patient with changing neurological function had been prepared for implantation without repeat neurosurgical review. Unable to control the medical argument, Bale turned to Evelyn's conduct. She had recognized restricted military identifiers, used an operational code, withheld a prior treatment relationship, and interfered with an approved study. I did not know he was here until this morning, Evelyn said. And now he refuses everyone except you. Grant forced out the word Priya. He trusted the neurosurgeon too, not because of her title, but because she had looked at the evidence and changed her mind. He refuses people who stop listening, Evelyn said. Bale accused her of being emotionally involved. Yes, Evelyn replied. I spent 19 hours keeping this man alive in a collapsed tunnel. I know what his face looks like when he is afraid, when he is in pain, and when he is warning someone. That history does not make me less able to see him. It should have been disclosed. It is being disclosed now. Too late. For your demonstration, yes. Bale extended his hand. Your badge. Hannah objected. Priya reminded him that Evelyn had prevented a procedure that could have worsened the compression. Bale said the process still mattered, even if the study no longer did. Evelyn unclipped the identification card from her coat. The title beneath her name was the life she had spent 6 years rebuilding. Evelyn Hart, MD. She placed it in Bale's palm. Grant's pulse rose. His head shifted slightly when a wheelchair brake was released, and his voice disappeared. Evelyn corrected the support before anyone else understood what had happened. Keep him neutral, she told Hannah. No flat transfers. Watch the thumb. If it stops moving, check position before assuming decline. Then she looked at Priya. Review the old imaging for retained surgical material near the posterior approach. Temporary stabilization hardware was used during cold passage. I do not know what remained after definitive surgery. Bale asked why she had not mentioned it before. You did not ask before trying to implant a device. Evelyn stepped away from Grant. His eyes followed her to the door. I said I would not leave while you were asking me to stay, she told him. I am still in the building. One blink. In the corridor, the residents who had laughed that morning stood near the nurses' station. None of them looked amused. Crane followed Evelyn toward the elevators and said she had not known Bale would suspend her. You gave Grant to me because you wanted to watch him humiliate me, Evelyn said. I thought it was harmless. You used a paralyzed man as a joke. Crane's face went pale. She said she had been frustrated because Grant refused every plan. He could barely speak, Evelyn replied. He was trying to survive them. Crane admitted she had sent the nursing notes to Bale's team and trusted that someone else would address them. Trust is not the same as checking. An alarm sounded inside Grant's room. Hannah adjusted the head support, and his oxygen rose again. The proof was small, immediate, and still not enough to protect Evelyn from administration. The elevator doors opened, but before she entered, the main corridor went quiet. 2 naval security officers appeared near the entrance with a tall man in a dark service uniform. Commander's insignia marked his collar, and he carried a sealed gray case. He looked at Crane, at Bale holding Evelyn's badge, at Grant through the glass, and finally at Evelyn. Recognition settled across his face. "I'm Commander Lucas Shaw, Naval Special Warfare Liaison." Bale stepped forward. "This is an internal clinical matter." Shaw placed the sealed case on the nurse's station and opened the first latch. "Chief Mercer's condition is tied to a restricted operation. Dr. Hart's involvement in that operation was not withheld from your government credentialing office. It was not available to my department," Bale said. "No. Then how were we expected to evaluate the conflict?" Shaw looked toward Grant's room. "You could have listened when the patient said her name." He opened the case and looked directly at Bale. "Who suspended the doctor my men called Valkyrie?" Shaw's question settled over the neurological wing. Bale still held Evelyn's badge, and for the first time that day, looked unsure what authority meant. "I suspended her," he said. "Pending review." Shaw opened the gray case. Inside were 2 folders, an encrypted tablet, and a faded black patch embroidered with a silver-winged figure. The word Valkyrie curved beneath it. Bale said military service did not exempt a physician from hospital policy. Shaw agreed, then added that policy did not erase relevant medical experience simply because the details were inconvenient. He opened the first folder. A photograph showed Evelyn 6 years younger in a dark flight suit, medical harness secured across her chest, helmet beneath one arm. Shaw read from the authorized summary. Captain Evelyn Hart, flight physician assigned to a joint recovery element supporting naval special warfare, advanced trauma care, prolonged field stabilization, confined space medicine, maritime extraction, and critical care evacuation. More than 800 flight hours and 27 high-risk recoveries. Bale looked at Evelyn. "You were active duty military?" "Yes." "You described yourself as a civilian emergency physician with prior service." "That was accurate." "Incomplete. So was the file your credentialing office received." Shaw explained that most operational assignments remained restricted. Bale asked whether Evelyn had treated Grant. Shaw looked through the glass at room 418, where Grant watched from his wheelchair with his neck held in neutral alignment. "Yes. Then the conflict should have been disclosed." "I did not know Mako was Grant Mercer," Evelyn said. The field call sign sounded too alive for the chart that called him resistant. Shaw opened the second folder. Operation Cold Passage. 6 years ago. A submerged access tunnel collapsed during a maritime recovery exercise. 3 operators were trapped beneath a flooded maintenance section. Chief Mercer sustained cervical trauma. Another man suffered a crushed pelvis. A third developed hypothermia and pulmonary injury. Hannah asked how long they were trapped. 19 hours after Dr. Hart reached them. Crane stared at Evelyn. "What did you do for 19 hours? "Kept them alive." Shaw gave the fuller answer. Evelyn had stabilized Grant's neck inside a tunnel too narrow for a rigid board, improvised ventilation with damaged diving equipment, rotated the few warming packs between 3 casualties, and entered a flooded section twice after the guideline failed. "The rescue team above did the difficult work," Evelyn said. "You controlled Mercer's airway when the water reached his jaw. That was my job. You went in after command suspended the attempt. There were men on the other side." Shaw nodded toward the patch. "That answer is why they named you Valkyrie." Grant made a rough sound from inside the room. Evelyn entered immediately. His pulse had increased, but when she asked whether the story was too much, he blinked twice. "No." His eyes moved toward the corridor. "Continue." Shaw stepped closer. When the extraction team broke through, Chief Mercer was barely conscious. He heard Dr. Hart guiding each casualty through the flooded section by tapping on a pipe. Grant forced out the words, 3 taps. 3 taps meant the passage was clear. Evelyn said. "Valkyrie coming," Grant whispered. The sentence cost him almost everything. Hannah adjusted the oxygen beneath his nose. Shaw called him Mako. Grant blinked once. Then, using the communication board, he selected the phrase, "She stayed after the order." Bale asked why Evelyn had left military service if her history was so distinguished. The room changed. Evelyn lowered the board and said it had nothing to do with Grant's diagnosis. Grant's eyes said otherwise. Shaw activated the encrypted tablet. Cold passage had officially been classified as a structural failure caused by operator error. A photograph showed a damaged metal locking assembly. The emergency release component supporting the tunnel had failed inspection twice. The contractor replaced the paperwork instead of the part. After the collapse, Command prepared a report blaming Mercer's team for activating the system incorrectly and delaying evacuation. Evelyn had been ordered to sign the medical section, which claimed the operators ignored symptoms and worsened their own injuries. "You refused," Bale said. "Yes. Why not expose it publicly? Because the report contained operational locations, equipment designs, and names of personnel who were still deployed." Shaw said Evelyn filed a protected objection through military channels. The contractor had political support. The investigation was sealed, and she was offered reassignment if she signed a revised statement. "I declined," Evelyn said. Crane asked whether she had been discharged. Shaw answered that she had resigned her commission quietly. Grant fought for enough voice to speak. "Not failed." Evelyn moved closer. He continued, pausing between words. "You refused to lie." For 6 years, she had imagined the operators believed she abandoned them. Grant remembered something else. He selected, "We knew." The shame did not vanish, but it shifted. For the first time, it no longer felt like proof. Priya entered with the newest respiratory results. Her expression ended the conversation. Grant's vital capacity had fallen another 12% since the previous day. Bale called the test effort dependent. Priya said they had repeated it 3 times with the same result. She placed a new scan beside the dynamic images. The arachnoid cavity was blocking fluid flow, and swelling below the adhesion had increased. Evelyn asked how quickly the decline could continue. Priya could not tell her whether they had hours or days. Bale warned that surgery remained extremely dangerous. Priya answered that waiting was dangerous too. Grant's oxygen fell despite support, and his right thumb took several seconds to respond. Priya crouched beside him and explained the choices directly. Surgery could worsen the paralysis, destroy the remaining hand movement, end independent breathing, or kill him. She could promise no recovery. Doing nothing might allow the last preserved pathways to disappear. Grant selected surgery. Priya asked whether he wanted to proceed. One blink. Bale said the decision was being made under emotional pressure. Grant selected one more word. Mine. Evelyn read. His decision. His body. His remaining chance. Shaw closed the military folder. Then the hospital will honor it. Bale still argued for a full conference and more time. Priya looked at Grant's shallow breathing and the thumb that was becoming slower with every response. "This is no longer elective," she said. "If we wait until morning, he may never breathe without a machine again." By 9:20 that night, Grant had been transferred from rehabilitation to the neurological intensive care unit. His motorized wheelchair was replaced by a hospital bed angled high enough to protect his breathing, and a rigid support held his neck in the narrow position his body still tolerated. Every movement required 3 people, continuous monitoring, and Evelyn standing close enough for him to see her. Priya reviewed the surgical consent at the foot of the bed. She did not soften the language. The scar tissue was attached to the surface of the spinal cord. Separating it could damage pathways that were still functioning. Grant might lose movement in his hand, wake unable to breathe without a ventilator, suffer a catastrophic hemorrhage, or die. When Priya asked whether he understood, he blinked once. When she asked whether he still wanted surgery, he blinked once again. Bale stood beside the window with his arms folded. Consent through blinking after an emotional military disclosure may not survive an ethics review. Shaw reminded him that Grant had communicated through blinking for months. Bale called the responses inconsistent. Evelyn answered that the system had been inconsistent because no one gave Grant a reliable way to use it. "You are suspended," Bale said. "You should not be participating in consent." Grant used the prepared communication board to select 3 phrases. Dr. Stays. My choice. Hannah testified that Evelyn was the first physician to establish reliable communication. A respiratory therapist confirmed that she was the first to connect his breathing decline to neck position. Owen, without a phone in his hand now, said he had witnessed the thumb movement appear and disappear with positioning. An administrator and an ethics physician arrived. They reviewed the dynamic study, nursing documentation, and Grant's communication pattern. The ethics physician asked questions with unpredictable answers to prove comprehension. Grant correctly rejected a false middle name, confirmed his real one, acknowledged the risks of surgery, and selected Evelyn as the person he wanted involved in planning and recovery. The administrator authorized Evelyn to return as a temporary neurological consultant for Grant's case while the suspension remained under separate review. Bale objected to her personal history with the patient. "So do you," Priya said. "You built a research program around him." The operation proceeded under Priya's authority. Evelyn clipped a temporary badge to her coat. The word consultant looked strange beneath her name, but Grant's pulse settled when he saw it. During the surgical conference, Priya displayed the dynamic images across 3 monitors. The arachnoid cavity expanded behind the cervical cord during flexion and partially collapsed in neutral alignment. Dense adhesions tethered the cord between C4 and C6. The plan was to open the back of the cervical spine, enter the dura, drain the cavity, and release the scar tissue under continuous neurological monitoring. While Priya reviewed instruments and blood preparation, Evelyn ignored the written reports and studied the original images. On a CT performed after Grant's first surgery, a small bright object appeared near the right side of C5, almost hidden by fixation hardware. "Go back," she said. Priya enlarged it. Bale called it a surgical clip or artifact. Shaw recognized the shape. Temporary stabilization pin. During the tunnel extraction, the field team had used a narrow metal pin beside the cervical frame to limit movement. Evelyn did not know whether it remained after definitive surgery. The new angle showed it close to the transverse foramen, where the vertebral artery traveled. A retained pin would have been documented, Bale said. "So were Grant's symptoms," Evelyn replied. A fast vascular CT was performed with Grant's neck maintained in the safest position. The fragment lay less than 2 millimeters from the right vertebral artery. It had not entered the vessel, but scar tissue wrapped around both structures. Priya changed the plan. Vascular instruments and blood would be in the room before the dura opened. A second surgeon would stand ready to control the artery. The fragment would remain unless removal became necessary. But no one would touch the adhesion around it without proximal control prepared. Bale remained silent during the revision. For the first time, he seemed more interested in the image than in defending himself. Shortly before midnight, Evelyn returned to Grant's bedside. The back of his neck had been clipped for surgery, and the anesthesiologist checked the airway equipment twice, because intubation could not alter his position. Grant selected a prepared question. "Will I walk?" Evelyn pulled a chair beside him. "I do not know." He waited. "The surgery may improve your breathing and protect the movement you still have. You could recover more function, but anyone promising that you will walk is selling you hope they do not own." He selected another phrase. "Do you believe there is something left? I believe your body has been trying to speak for 8 months. I cannot promise what it will say after we free it." His thumb moved once. Grant asked whether she had been afraid in the tunnel. Evelyn told him the truth. She had feared the water rising, the passage collapsing, and making the wrong decision. But fear had not been the most important thing in that tunnel. The next decision had. His final request was simple. "Stay when I wake." "I will." As the medication entered his IV, Evelyn reminded him that he was not underground. Priya was operating. Shaw was outside. Hannah would be in recovery, and Evelyn would be there when he opened his eyes. Grant watched her until the final second. The operating room was cold. Grant was positioned face down with his neck fixed in exact neutral alignment. The monitoring team established weak but present signals from the right thumb, left forearm, and both legs. They were not strong enough to create visible movement, but they proved the cord still carried information. Evelyn remained outside the sterile field beside the imaging screens. Her role was to track positioning and warn Priya before she reached the scar surrounding the metallic fragment. The first stage went smoothly. Priya removed part of the posterior bone and exposed the dura. When she opened the membrane, trapped fluid escaped under pressure. The neurological signals improved slightly. No one celebrated. The most dangerous work had only begun. Priya separated the arachnoid adhesions 1 millimeter at a time. Some released easily. Others clung to the cord like wet paper. She paused whenever the signals changed. "You are approaching the right lateral adhesion," Evelyn said. Priya saw the fragment beneath the scar tissue and continued from the opposite side. For several minutes, the pathways remained stable. Then the anesthesiologist adjusted the table to improve ventilation. The movement was less than 2 degrees. The right-hand signal vanished. Then the left. The sensory pathways disappeared one after another. Priya froze with both instruments above the cord. The anesthesiologist returned the table to its previous angle, but nothing came back. The leg signals vanished next, and a straight line replaced every pathway Grant had carried into the room. The monitoring technician checked every connection and looked at Priya. We lost everything. For 3 seconds, no one in the operating room moved. Priya kept both instruments suspended above Grant's spinal cord. The monitoring technician checked the electrodes again, then the cables, then the machine. The result did not change. Every motor and sensory pathway had disappeared. Bale stood behind the observation glass. Stop the procedure. Priya did not answer. She had not cut the cord. She had not divided the adhesion around the metal fragment. The loss had happened between one breath and the next. Evelyn looked at the surgical video, the monitoring timeline, and the table position display. The signals vanished less than a second after the anesthesiologist changed the angle. What exactly did you move? She asked. The head of the table, less than 2 degrees. Forward or backward? Forward, with a slight rotation to the right. The table had been returned to the previous numerical angle, but Grant's neck was held inside a multi-point frame. A change in the table did not guarantee the same pressure at the skull. Evelyn moved to the frame display. The right support carried slightly more force than before. His head did not return to the same position. Bale's voice came through the intercom. The table was reversed. The table was. The pressure distribution was not. Priya looked toward Evelyn. What do you want? Release the right contact by 1 millimeter and rotate left less than 1 degree. Bale objected. You are proposing movement around an exposed spinal cord based on a pressure reading. I am proposing that the same positional compression we documented outside the operating room is happening now. If you are wrong. If I am wrong, we stop. If you are right and the cord is already destroyed, 1 millimeter changes nothing. If I am right, waiting is what destroys it. Priya made the decision. Do it. The anesthesiologist adjusted the frame under Priya's direction. 1 millimeter. A fraction of rotation. Everyone watched the screen. Nothing. Bale said, "End the operation." Evelyn stared at the monitoring timeline. During the dynamic scan, Grant's thumb had not returned immediately. It had taken several seconds after neutral alignment. Wait. 5 seconds passed. Then a weak line appeared in the right-hand channel. The technician leaned forward. Possible response. A second pulse followed. Then the left forearm returned. The sensory pathway from one leg flickered, disappeared, and came back stronger. Priya exhaled slowly. The cord is still conducting. The right thumb signal rose above baseline. Evelyn closed her eyes for half a second. Grant had not lost everything. His body had worn them again, even under anesthesia. Priya resumed the operation without wasting another moment. She released the central adhesions first, creating space around the cord. Fluid began moving through the channel in a way it had not for months. The monitoring signals improved as the pressure fell. The final adhesion wrapped around the metallic fragment and the right vertebral artery. Priya worked beneath magnification while the vascular surgeon prepared proximal control. One strand of scar separated, then another. The fragment shifted. Bright blood filled the field. Vertebral artery, the vascular surgeon said. No one panicked. The danger had been identified before the first incision. Proximal control was ready. Suction was already in position, and blood waited in the room. Priya held pressure while the vascular surgeon placed a temporary clip above the injury. The bleeding slowed. The fragment had scraped a small branch rather than opening the main artery, but the margin was measured in millimeters. Bale watched through the glass, his face drained of color. Without Evelyn's review of the old imaging, the team would have entered that scar without vascular preparation. The fragment was removed. Priya repaired the branch, released the remaining tether, and watched the cord settle into a wider channel. The monitoring technician called out each improvement. Right hand stronger. Left forearm present. sensory responses through both legs. No miracle, no sudden restoration. Only pathways that had been compressed finally carrying cleaner signals. The operation ended shortly before dawn. Grant remained intubated in the neurological ICU, while swelling and sedation were allowed to decrease. Evelyn sat beside the bed with the old communication board resting against the wall. Shaw brought coffee she did not drink. Hannah checked the head support every few minutes, even though Grant was unconscious. Bale entered after sunrise. He stopped at the foot of the bed. "The board has suspended the implant study," he said. Evelyn did not look away from Grant. "That is appropriate. They are reviewing every patient enrolled under the complete injury criteria. That is necessary." Bale waited, perhaps expecting anger. Evelyn was too tired to give him the version of the conversation he had prepared for. "I saw the nursing notes," he said. "All of them. You had them before." "I saw the words. I did not see a pattern." "You stopped looking for one." He nodded. "Yes." The admission sounded smaller than the damage it described. Bale said the study had begun with good intentions. Grant's case had attracted funding, military attention, and the possibility of helping patients with severe injuries. Each new symptom threatened the classification that made him eligible. Bale had convinced himself that protecting the study also protected Grant's chance of treatment. "You treated contradictory evidence as interference," Evelyn said. "Yes. And a patient as proof of your theory." "Yes." The hospital had removed Bale from leadership of the neural program pending a formal review. He would remain a physician only under supervision until the investigation ended. He planned to speak before the board and accept responsibility for the ignored escalation notes. Evelyn finally looked at him. "Do not apologize to me first." Bale turned toward Grant. "I know." Grant began waking that afternoon. Priya reduced the sedation, and the breathing tube was removed only after he proved he could maintain his airway with his neck protected. His first breaths were shallow, but they were his. Evelyn stood where he could see her. "You are in the neurological ICU." The compression was released. There was bleeding, but it was controlled. "I am not going to ask you to move everything." His eyes focused slowly. "Can you feel me touching your right shoulder?" One blink. "Your forearm?" One blink. "Your thumb?" A pause, then one blink. "Do not force it. Move the right thumb once." Nothing happened. Hannah stopped writing. Shaw looked toward the floor. Evelyn waited. "Your body has been ignored for 8 months," she said. "It does not owe us speed." Grant's thumb pulled inward a few millimeters. His eyes filled. The movement was small enough that someone passing the door might have missed it. No one in the room did. Priya tested the left hand. 2 fingers produced a faint contraction that had not been visible before surgery. Sensation below the injury remained incomplete and confused. But Grant reported pressure in both feet through the communication board. Bale stood outside the glass. When Grant noticed him, the monitor climbed. Bale did not enter until Grant blinked once in permission. "I was wrong," Bale said. "You told us your condition was changing, and I made your inability to convince me part of the diagnosis. I am sorry." Grant stared at him for a long time, then selected a phrase from the board. "Listen next time." Bale nodded. "I will." The following day, administration restored Evelyn's privileges and removed the suspension from her record. Crane submitted a written statement admitting that she had assigned Grant to Evelyn as a joke. Owen admitted attempting to record the encounter. Both entered the review process without excuses. Grant's recovery remained uncertain. Priya warned that swelling could still take function away and that months of rehabilitation would be required before anyone understood the full result. On the 3rd evening, Evelyn helped position his communication board. Grant selected a question that took longer than the others. "When I leave this chair, will Valkyrie disappear again?" Evelyn did not answer Grant's question immediately. She looked at the temporary consultant badge clipped to her coat, then at the man who had remembered a name she spent 6 years burying. "I left once because I thought silence protected everyone," she said. "It did not protect you, and it did not protect me." Grant waited. "No, I am not disappearing again." His right thumb moved once. Recovery did not arrive as a miracle. It arrived in measurements so small that only people who had learned to listen knew their value. During the first week, Grant breathed without mechanical support for longer periods. By the second, he could move the right thumb and index finger enough to activate a large switch. The left hand followed more slowly. Sensation returned as fragments: pressure in one foot, heat in the other, the rough texture of a blanket against his forearm. There were setbacks. Swelling increased on the 6th day and weakened his voice again. A respiratory infection kept him in intensive care longer than expected. Some mornings, the movement in his hand was less than the day before. Priya never promised that progress would continue in a straight line. Evelyn kept the communication board within sight, even after Grant could operate a tablet with his right hand. No one called him difficult when he refused a position. They asked why. No one documented silence as non-compliance until they checked whether his voice had changed. Every transfer included a neutral position checklist created from the symptoms the hospital had ignored. Dr. Crane came to his room 2 weeks after surgery. She asked to enter and waited for Grant's permission. "I gave you to Dr. Hart because I thought watching the new doctor fail would be funny," she said. "I turned your dependence into entertainment and called it frustration. I am sorry." Grant typed his response slowly on the adapted tablet. "Why did you think I was the joke?" Crane looked at the floor. "Because you could not answer quickly enough to stop us." Grant typed again, then learned to wait. She did. Owen Price returned too. He did not ask Grant to forgive him. He admitted recording a patient without consent and offered to participate in a hospital project on communication rights for patients with paralysis. Grant agreed on one condition. Owen would begin every training session by telling the truth about why the project existed. 3 months later, Grant controlled his motorized wheelchair with his right hand. He could feed himself with an adaptive utensil, lift both forearms against gravity, and remain upright without the same respiratory collapse. During physical therapy, braces and a standing frame allowed him to bear weight for 40 seconds. He did not walk out of the hospital. He did something more important to him. He left his room under his own control. The formal review found that Bale had not intended to harm Grant. It also found that he repeatedly interpreted evidence through the needs of his study, failed to investigate nursing escalations, and allowed research timelines to influence clinical judgment. He was removed permanently as director of the neural stimulation program. Before returning to supervise clinical work, he addressed the hospital staff. "I believed experience protected me from being wrong," he said. "It only made me better at defending the mistake." Grant watched the recording once and never asked to see it again. Potomac Veterans Neurological Center changed more than one job title. Any diagnosis labeled complete or irreversible now required scheduled reassessment when symptoms changed. Positional neurological complaints triggered independent review. Patients with limited speech received an individualized communication plan within hours of admission. Nurses could request a second neurological evaluation without approval from the original attending physician. Research enrollment could never delay diagnostic reconsideration. The old letter board from room 418 was mounted in the training center, not as a trophy, but as evidence of how little equipment had been needed to hear Grant. Beneath it, a plain card carried one sentence: "A patient who cannot speak quickly is still speaking." Evelyn was asked to lead a new complex neurological diagnosis unit. The title sounded larger than the work. The work remained simple. Examine the patient who did not fit the chart, listen to the person everyone called resistant, and reopen the diagnosis when the body kept disagreeing. Commander Shaw visited on the day she accepted. He placed a small black box on her desk. Inside was the faded Valkyrie patch from the sealed case. "This belongs to you," he said. Evelyn touched the repaired edge. "I resigned the commission." "You did not resign the reason they gave you the name." She did not sew the patch onto her white coat. She placed it inside her medical bag beside a stethoscope, reflex hammer, trauma shears, and the hospital badge that read, "Evelyn Hart, MD, not hidden, not displayed, carried." Grant returned to the neurological wing 6 months after surgery. His wheelchair moved beneath the control of his right hand. He could speak in short sentences without losing his voice, though fatigue still reduced it to a whisper. Braces supported his legs during therapy, and 2 therapists helped him stand for nearly 2 minutes. The staff members who had gathered to watch the rookie fail now gathered for a different reason. Hannah stood beside Grant. Priya leaned against the therapy rail. Crane and Owen remained near the back. Grant looked at them, and then at Evelyn. "Still think she is the rookie?" A few people laughed, but no one laughed at him. Evelyn adjusted the support behind his neck. "I was new to the building, not to listening." The hospital opened its first communication and diagnostic reassessment training session that afternoon. Grant spoke about the months in which people recorded his refusal, but never asked what he was refusing. Hannah showed the notes that had been dismissed. Priya explained how a neutral scan had hidden dynamic compression. Crane described what humiliation looked like from the side of the person causing it. No medal ceremony followed. No military formation filled the hallway. Grant wanted no spectacle. He wanted the next patient heard sooner. That patient arrived before the week ended. A former Marine in another rehabilitation room had been classified as minimally conscious after a stroke. His family insisted that his eyes changed when they spoke, but the movements were called random. A nurse trained under the new protocol noticed that he looked left only after hearing his daughter's name. She did not wait for morning rounds. She called Evelyn. Evelyn entered the room, checked the position of the patient's head, reduced the number of people surrounding the bed, and built a communication system from one reliable eye movement. The first answer took almost 4 minutes. No one rushed him. No one called the silence refusal. Outside the room, Grant waited in his wheelchair. When Evelyn emerged, he raised his right thumb. Her white coat said doctor. Grant knew the name that mattered more. When wounded men could no longer make the world hear them, Valkyrie listened.